Good afternoon. And today we have a pleasure of interviewing Dr. Janice Goodman from Canada, Toronto. Good afternoon, doctor.
Nice to see you, Maria. Good afternoon.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, please click the like and share button. This way you can spread the word about different approach to dentistry and sleep we're trying to make known on our channel. If you are a medical professional, please use our channel as a networking ground because I interview or collaborate with amazing group of professionals, dentists, doctors, and in other fields who are trying to help people with sleep and breathing disorders. Because the main goal of this program is to create community, because only together we can find all missing pieces and help our patient to find this silent but really dangerous disease. And I want to introduce you our guest, Dr. Janice Goodman. And as you know, I devote a lot of programs to the memory of my mentor or our mentor, Dr. Ted Belfor, who passed so suddenly and totally huge loss for us in December. And I'm trying to put together the people who were influenced by his teaching, who practice according to his principles, and actually shine the light on his philosophy, which I think gonna change the way we practice dentistry for the future generations. So let me introduce you Dr. Janice Goodman. She's been in practice for more than 30 years. She practiced whole body dentistry in Toronto, Canada. So we welcome, we have people from different countries, and you're not the first Canadian, but we didn't have that many Canadian specialists, so we're very honored. And she is a master of oral medicine. She has a lot of knowledge, a lot of recognition. She is a diplomat of American Academy of Craniofacial Pain. She is a diplomat of American Academy of Craniofacial Sleep Medicine. And she's on editorial board of Oral Health magazine from General Dentistry. And I actually recommend you to check Janice's articles. I think they're very valuable. And besides talking about Dr. Belfor, we're also going to talk about invention of what Janice working on, which is a mouthwash, what help us to become healthier. So I would like to ask you my first question related to Dr. Belfor. Please tell us your story of collaboration with Dr. Belfor and how his teaching affect the way you practice.
Well, first of all, thank you for inviting me to the podcast today. Second of all, Dr. Belfor was a very important mentor in my life also. We met a long time ago, over 30 years ago. We studied quite a bit together, and we learned together many things. But at the time, our travels, this journey was like a rabbit hole, and every time we turned a corner, we became more involved with a different subject kind of thing. And it was really nice having someone that you could talk to and you could go over ideas with, kind of thing. I first met him actually in Toronto when he came to Toronto to do a certification course about his homeoblock appliance. I'd never heard of epigenetic orthodontics at that point. And he explained what it was, and it made a lot of sense. And orthodontics made a lot of sense when you looked through his eyes and saw and his ideas. So after that, I started this journey with him, and I miss him a lot because he helped a lot of people, not just the dentists he taught, but the patients that he's treated. He's made a big difference in their lives.
I would like to ask you, can you share specific experiences, what you had with the homeoblock treatment and the cases you treated? And I know you successfully treat a very difficult case in your family, your daughter. So can you talk about how homeoblock treatment improved the life of your patients?
So every patient is unique, and each patient has a slightly different problem that you have to figure out how to help. But in the case of my daughter, she had a situation that she was biting more on one side than the other, and that's a common scenario. But it was really bothering her, so we tried a number of orthodontic solutions to try and get her to bite more on the side that she wasn't hitting. Nothing worked, nothing. And it was frustrating. At some point, her jaw was starting to hurt her and she was getting headaches. So I sent her CBCT, her 3D x-ray, to Dr. Belfor. We went over it together, and he made a suggestion of putting in a homeoblock with an acrylic pad that's unilateral, is only on one side. So in this case, if you look, it's on the patient's right. So if you look on the left, you can see that there's an acrylic block. And you just bite on that one side, and it puts tangential forces through your head. And it's not the teeth that are straightening up so much, but it is the bones that are shifting. And in fact, within the week, after trying all these other things, she could bite on both sides. And even when the appliance wasn't in, she could bite on both sides. So it fixed something.
No, that's very nice to hear. I would like to ask you, what's other important aspect of Dr. Belfor teaching brought such a difference in the way you practice, I would say, whole body dentistry? I know he was really big when he talked about breathing and the different gases we use. So how you incorporate that part of teaching in your practice?
Well, one thing that Dr. Belfor talked about a lot with me anyways is that it's not it's not just about oxygen. It's a 3-gas system. And the oxygen, while you need it, too much of it is also dangerous. But CO2, carbon dioxide, and nitric oxide are just as important. In fact, the carbon dioxide might be the most important of the 3. So these days we mouth breathe quite a bit. We blow off a lot of oxygen. We talk too much. We're on our phones a lot, blah, blah, blah. So our levels of carbon dioxide are lowered in our bloodstreams. So what happens is you can actually get less blood going to your brain because of vasoconstriction, because you've lowered your levels of carbon dioxide. So it's very important to know what triggers you to breathe too much, or to breathe through your mouth instead of your nose, and to breathe too deeply necessarily, or whatever. It's a good thing to know what triggers it, so you can try your best to untrigger it, so that you can get your levels of CO2 higher.
I really like what we talk about nitric oxide, and what you make such a connection about this gas and really
microbiome.
Microbiome, as well as a lot of chronic disease what exists in our population. Like, people come to me and they bring me like a bouquet of different chronic disease what they have. And I want you to talk more about nitric oxide in connection with the chronic disease. Why nitric oxide is so important?
So there's 160,000 articles and books written about nitric oxide. So it would be hard to say that in a sentence, but it's a new molecule. It was found in 1980, and we're learning more and more about it all the time. But one thing I can say is there's only 2 ways that you get nitric oxide that we know about right now. One is it's made inside your body enterically through an L-arginine pathway. And that decreases 10%, 10 to 20% every decade. So by the time you're 50, you only have 50% nitric oxide than you had before. And the other way is in your mouth, at the back of your mouth. And commensal bacteria, good bacteria, make nitric oxide. And without that, you are going to get chronic degenerative diseases.
Yeah, I know Dr. Belfor constantly talk about that gas, and I like that case what he talk about the treatment with homeoblock, how homeoblock was able to clean the sinuses and increase the production of nitric oxide. But I like what you mentioned about the bacteria, especially now in a time, we just live through COVID and every single person use the hand sanitizers, at one point or another. And in the mouth, we use the mouthwash also to clean the bacteria. So tell me, why is that might not be the best idea to use the regular mouthwash and how it can become damaging to our health?
So mouthwash is the devil. I should say most mouthwash, not all mouthwash. The reason is it kills across the board. It kills the good guys and the bad guys. And what you need is a mouthwash that is selective so that it leaves the good commensal bacteria. Just like on your hands, you need some bacteria. There's more bacteria in us than we have our own cells. So we want to encourage the good guys through probiotics and prebiotics and good oral hygiene, that kind of thing. But most of all is don't allow the bad pathogenic bacteria to get ahead of the commensals by wiping everything out. Encourage the commensals to live. The other thing I'd really love to point out is if you use a mouthwash and you don't produce nitric oxide because the commensal bacteria are affected, you get vasoconstriction. Your blood pressure goes up within seconds after using it. You know that, right? Not everyone listening to this might know that. They should know mouthwash has been shown, demonstrated by Neil Nathan to raise your blood pressure immediately.
That's quite dangerous. And I noticed that's one of the common disease what people come in my practice. Everybody said, I have high blood pressure, I have high blood pressure, I have high blood pressure. So it's just like, like Tuesday become, but I want to go back to microbiome in our mouth. And I want to ask you, what exactly the microbiome and why is it so important?
So the oral microbiome is becoming better known for what it does now than it ever has been. It is a collection of the bacteria and the living organisms within your mouth or your oral cavity. And we have found so far 5 nasty bacteria we call the keystone bacteria. They're periodontal bacteria generally. P. gingivalis is one of them. P. gingivalis is associated in the brains of Alzheimer's patients. We know that now. But we know these 5 bacteria can attach to your leukocytes or other cells and travel around your body and get into other bacteria and other cells, and they can actually change the protein in those cells and change them from good bacteria to bad bacteria. And this has a tremendous effect on your immune system.
Yeah, that's very scary. So what should we do if people love my dog also listening? If people love to use mouthwash, I noticed what you wrote a lot of articles and you talk about molecular iodine, what you use in your practice. Maybe that can be alternative, or maybe I know you work on inventing or putting into public eye the other idea for mouthwash. Can you please talk about molecular iodine as a
So
replacement?
molecular iodine is available and can be purchased online, and it is better than a lot of other mouthwashes to use chronically. So if you're going to use something chronically and you have gum disease, it's a fabulous thing to use because it's available. We can't get it in Canada. to be honest, but if you're in the States, you can get it from Iotech International. They're out of Boca Raton. What we can get in Canada and you can get in the States is hypochlorous acid. Now, the reason I slightly prefer that over the iodine, molecular iodine, is that it is more selective and it won't kill your good bacteria. It'll only kill the very bad bacteria, and it is very effective at doing that.
Can you talk a little bit more about that hypochloric acid and why is it so different from Listerine?
Okay, it's not hypochloric, it's hypochlorous. There's a big difference.
Hypochlorous, yes.
No,
yes.
that's okay. I just want to make sure.
Hypochlorous.
So what are you interested in exactly?
I would like to know what
About
exactly it is.
Okay, I have to tell you because it's fantastic, actually. It's natural. When I say natural, I mean it's from your body. You make it yourself. It's in your body. It works for you. Your white blood cells use it to kill viruses and bacteria themselves. Your own system uses it. So what happens in your body is the white blood cells give off bursts of the hypochlorous acid, but it's only for a millisecond at a time. So you can't really bottle it and use it as a mouthwash. But recently, scientists have figured out in the lab how to produce this stuff in larger quantities, inexpensively, for the purposes, and with a 2-year shelf life, for the purposes of cleaning your eyes, cleaning your nose, cleaning your mouth. And just want to say that for me, during COVID, one of the prime things I did, I used molecular iodine. I sprayed it in my nose and my mouth. And I'm also now using hypochlorous acid, spraying it in my nose and in my mouth. And I don't know, everybody that I've given it to who's used it, nobody's used it and gotten COVID, but that doesn't necessarily mean anything. I've never gotten COVID.
No, that sounds so promising. And I like what it's kind of like a naturally produced and doesn't kill the good bacteria because, I think the idea what we changing so much of our microbiome, maybe that's the leading reason for so many chronic diseases.
And it doesn't raise your blood pressure either like normal mouthwash would. Has no effect. It's a neutral pH. It doesn't affect your teeth. It doesn't discolor your teeth. It doesn't taste bad. It's just like one of those things like, really? I don't know why the world doesn't get it yet, but they will.
So maybe now with your help, we're going to have it. We're gonna get healthier. Yes, I really hope so. So my last question to you, because we're talking about memory of Dr. Belfor, who, brought so much to the scene, I would like to ask you, is that such a thing as a cure for sleep apnea based on his teaching?
Well, I know exactly what Dr. Belfor would say. He'd say, you can never say you have the cure for sleep apnea. That wouldn't be right. But I've seen with my own eyes that he has been able to figure out underlying causes of an individual's sleep apnea, address it, and fix the underlying problem. And guess what? They didn't have sleep apnea anymore.
We're talking about personalized medicine.
You got it. And that's the only way to do this because everyone is different and their problem's different, and you really have to figure it out before you come up with a solution.
Thank you very much. We really appreciate your presence, and we're looking forward to that new mouthwash. And thank you very much.
Thank you, Dr. Sokolina.